Thanks so much for having me on your channel. I really appreciate it. This is all new to me, this streaming, and I want to get into streaming, so I really appreciate that in general. And yeah, so Cassava Sciences, Alzheimer's disease is one of the biggest problems in the world now. With all the other diseases, cancer, heart disease, there's been good progress in medicines and things, not the case in Alzheimer's. And then with all the baby boom generation getting older, huge problem, and it's going to get bigger. This company, Cassava Sciences, finally looks like they have something, very much looks like they have something. And so yeah, so that's what I'm here to talk about. So if you're into, this is the IRL, I don't know what video games have business or medicine in them, but there's
Yeah, I mean, you're touching upon really everything, but so before we dive further into this, we're gonna have a couple questions that I have for you here. But before we do that, let's just put out the disclosures so that we can save both of our butts, just in case someone does decide to come after us for whatever reason. Joe, would you like to go first?
I'm long Cassava Sciences. Everyone I know that listens to me since the beginning of the year is long Cassava Sciences. So I have a conflict of interest. Although no one put a gun to my head and said buy Cassava Sciences, I'm long because it's such a good buy.
And I'm right there with you, Joe. I mean, I will disclose I do have positions, whether it's long, whether it's options, whether it's derivatives, any and all the above. I want to fully disclose that I am invested in this company. By no way, shape, or form should anyone take this as advice or see this as an investment suggestion by any means. I highly suggest that you do your own due diligence. Look into this company yourself before you make any sort of investment decision on it. I wanted to give full disclosure on behalf of myself, and I think Joe would agree here that this is truly us expressing our own thoughts and opinions here. Joe is the expert. I'm kind of just the mediator here to get the information out there. That's the truth of the information that's out there, at least as we see it as the truth. So with that being said, unless you have anything else, Joe, we can dive straight into these questions.
This is my first chance. Everybody's always giving that disclosure. I'm not an investment advisor. This is not investment advice. So yeah, my chance here. Thank you. I'm not an investment advisor. This is not investment advice. I'm so excited to finally say that.
Yeah, right. Again, and you have to do it because someone's going to ask, and that'll become an issue. So, overview of Cassava Sciences, as you mentioned, biopharmaceutical company focused on the detection and treatment of Alzheimer's. We're talking about SAVADX, which is a blood test essentially, right? That is supposed to detect early Alzheimer's, and then SIMUFILAM, which we can go into in a second. But do you want to give a little bit of a description on each of those?
Sure. Well, so you start with SAVADX. So Alzheimer's disease is generally only diagnosed after symptoms have already manifested. So people start having problems, memory and behavioral problems, and then they go and they get tested. And there's still not a very good test even then. What they'll do is they'll interview the person, they'll interview family members, they'll do brain scans maybe, and they'll do cognitive tests, and they'll do biomarker tests. And the best biomarker tests, or the most accurate ones, require a spinal tap, which now you have Alzheimer's and they're poking your spine. So you don't. So it's a big. So not only that, it's still not a very quick test either. And then Alzheimer's disease is a disease of continual decline. So you would want to nip it in the bud early. If there were interventions or if there was just life planning, you would want to know early. So there's not only is there not a good treatment until now, likely I'm saying. But there's not even a good way to detect it, and you can only really detect it with 100% accuracy right now in an autopsy. So there's not good detection, and so Cassava Sciences developed their medicine SIMUFILAM. Along with that, they said, you know what, the target of this medicine, we're actually able to detect it in the blood. And so we could actually use that to determine if they have Alzheimer's disease or not, to diagnose if they have Alzheimer's disease or not. And so that's the idea of it in one quick blood test, not a spinal tap. So a quick and easy, painless blood test. You could either immediately or quickly, if not immediately, you could quickly get a diagnosis. And so is it AD, or maybe it's a different form of dementia. and now you've ruled out AD, and now you can treat that other form of dementia. So that's important by itself. But then you talk about SIMUFILAM, if that, it looks like it really is a treatment that works and is very safe. And so now you can detect Alzheimer's disease before symptoms manifest, and you can treat it. So for people that have Alzheimer's disease, for people that have Alzheimer's disease in their families, very huge news, and then also the investment case as well.
So when we're just to take a couple steps here. So SAVADX, I mean, you're talking about a blood test. It's very, very simple to kind of do, as opposed to, like you said, a painful spinal tap. No one's really going to want to sign up for that. But I think the big thing is that SAVADX is proprietary, right? There's no one else that can use this. It's not currently active in any a doctor's office per se, but they are trying to implement this, correct?
Yes, so it's with SIMUFILAM, which is the medicine to treat Alzheimer's disease. There's good patents there, including composition of matter patents, which are considered the strongest. With SAVADX, which is the diagnosis, there's not patents, but there are industry secrets, and it really has to do with they haven't really let on how their SIMUFILAM medicine has an extremely high, an ultra high affinity for its target. So they haven't really let on how they came across such a high affinity medicine, and they haven't let on a whole lot about the technology. So for now, it is trade secrets, but it's actually important to say that the medicine itself has strong patents. The detection does not have any patents. It does have trade secrets, and it's possible that it cannot be replicated easily anyway. But that one actually does not have patents. But from the business case, even if it was free, even if they gave it away, SIMUFILAM looks like it works. So as long as everybody was diagnosed from a business case, who cares? That's such a huge market in such dire need of treatment. But so it has trade secrets, but it doesn't have intellectual property at this time. So important to point that out.
Okay. And so with that being said, obviously these guys, it does seem as though they are kind of, yeah. Can you hear me?
Did I bore you to tears? I bored you to death.
You can,
Hey.
You can still hear me?
Yes. Now
Okay, there you go. So I don't know what happened there. Sorry about that. No, what I was just saying is obviously these guys seem like they are at the forefront here, along with some of these other big guys that have already come out with some drugs and other quote treatments that they perceive to be, I guess, leading in the market, if you will. We're talking about Biogen, we're talking about Eli Lilly, and we're talking about Enovis. I guess could you point out what the biggest, I guess, accomplishments to date that you think Cassava has that differentiates itself from the other Alzheimer's, candidates in the space, and how the mechanism of action is different? Why are these guys so different? Why should people be taking the smaller guy in the space here so seriously versus some of these bigger guys that, depending on what side of the fence you're on, may or may not have credibility?
Great question, and it's maybe the best way to showcase what they have and why it's so great is to compare it to what else is out there. So you brought up Biogen. Biogen, of course, just got approved first drug in like 18 years in the United States for Alzheimer's disease. And it's not even clear that it has a benefit. And it was the advisory panel voted overwhelmingly to not approve it. And then had a number of resignations. Independent panel voted 15-0 that it didn't show a benefit, or there was not enough evidence to say it showed a benefit. And Mount Sinai and the Cleveland Clinic both categorically said we are not administering aducanumab. So that's a pretty darning indictment. If you look at what they're even claiming, the best they're even claiming is after a really high dropout rate, there was that some patients declined slower. So they're not even showing a cognitive benefit. They say that there's about a 30%, both for Biogen's aducanumab and for Eli Lilly's donanemab. They both show about a 30% decline of a slowing of decline rather than a benefit. And so that's okay, great. So I guess that's okay because it's like pretty safe and well tolerated, right? No, not safe and well tolerated at all. So there's brain swelling and brain bleeding, and then plus you have to go into the clinic and get an infusion by needle. It takes like half an hour to get the treatment. There's oftentimes a reaction with like chills and flu symptoms temporarily, in addition to the brain swelling and things like that. And then it costs $56,000 and requires an MRI possibly. So it's a terrible treatment that probably doesn't work. And so
Jeez.
compare that to Cassava Sciences SIMUFILAM. Well, it's shown. So how does it stack up? 4 points I want to make mostly. The 9-month efficacy, they have other ways of showing efficacy. They showed it in mice. They showed it in a placebo-controlled trial. They showed it at 6 months. Now they've shown it at 9 months. Strong efficacy for strong cognition efficacy at 9 months. No one's ever shown it at 9 months. Aricept, which was the last drug approved before aducanumab in 2003, at 6 months looked a lot like SIMUFILAM, Cassava Sciences SIMUFILAM, as far as its benefit. And then it fell off a cliff because it was just like drinking coffee, in that it was stimulating receptors, and eventually you oversaturate and they downregulate. So it's the only drug ever to show benefit at 9 months, and the benefit is growing. So it's like, well, if it was just stimulating receptors, I guess it would be starting to fall off. It's growing, and it's Alzheimer's disease, like a number of other diseases, is a misfolding protein disease. So there's a number of proteins, one of them called filament A. This is where it gets complicated. There's a protein in the brain called filament A. In Alzheimer's disease patients, it misfolds and then starts a toxic cascade. And so SIMUFILAM targets that. And so small molecules that target misfolded proteins, like SIMUFILAM, have shown really persistent benefit that even grows. And so it's pretty encouraging what they showed at 9 months. So 9-month efficacy data is sensational. People are getting better, not just getting worse more slowly, maybe. People are getting better, and it's growing. The benefit has grown from 6 months. So that's one thing. Efficacy at 9 months. Nobody's ever shown efficacy at 9 months at all. And then the 6-month biomarker data. Okay, so in the 9-month ongoing open label trial now, the critics say, well, it's open label, there's no placebo group, even though we can point to more than 20,000 patients taking placebo in open label, in placebo-controlled trials, and what they look like. So we know what placebo groups look like. We know how people decline that have mild to moderate AD. We know how they decline. So even though that's the case, the critics say, well, it's still an open label, so you need placebo control. It could be a placebo effect. The fact that they're getting a pill, it could be a placebo effect. And maybe it could be a placebo effect, although after 9 months, that's in a disease of continual decline, like Alzheimer's disease, it's very unlikely. Plus, they already did a placebo-controlled trial, and it went extremely well.
So,
but even, yep, go ahead.
no, I was just going to say, so that's kind of a differentiator, right? Like there was a lot of criticism surrounding the fact that it wasn't, that there was no placebo, but they knew that going in, even, when you're talking about the 6-month data, when you're talking about the 9-month data, so you're looking at the 9-month data now and you're seeing that, you're seeing an improvement from 6 months, and at 6 months, they knew it was open label. It's not necessarily that okay, we're going to shift gears here or anything. They knew at 6 months it was open label, and then comparing those results at 6 months to 9 months, which we're looking at as of Thursday when they reported at the AAIC conference, you're talking about a significant improvement. If you want to dive into the biomarkers and everything, and maybe give a little background of what that means, because for some people that don't understand what that is. But I think the difference here is that we're showing an improvement from 6 months to 9 months, which has never been done before in, the history of the world, I guess, if we really want to get dramatic about it. So, you're talking about seriously groundbreaking stuff, right?
Yeah. That's right. So 9 months, never been done before, hugely groundbreaking stuff. And then there's the critique, well, it's not placebo controlled. So now I'm about to talk about the biomarkers, but we should point out that this trial was started by a placebo controlled trial with 64 people in 3 different arms. It went extremely well. Then they said, this went so well, let's keep some of these people and then expand it to a lot more people, go into the open label. And then at 6 months, as they said, gee, it went so well, let's expand it some more and put a placebo-controlled trial at the end of this, which about half. So in the end, they're going to have 100 people go through a 6-month placebo-controlled trial at the end of this 12-month open label. And that's about half enrolled already. So we saw the people at 6 months, now we're seeing them at 9 months. Those people, about 50 of them or so, are already through 12 months into the placebo-controlled portion. So there's the critique of that's not placebo-controlled, but it started with a placebo-controlled trial that went extremely well. It's ending with a placebo-controlled trial, and now let's get into biomarkers. So biomarkers are, like we said, the spinal tap. So there's amyloid beta 42. So there's these peptides. So we've probably heard about like amyloid beta plaques. There's a whole bunch of different peptides of these proteins, and they're toxic. And if you detect them in cerebral spinal fluid or in the blood or wherever you're looking for them, you can then say, well, even we don't have to necessarily, let's not look at whether they're doing better cognition-wise. Let's just look at these biomarkers to see if it looks like they have Alzheimer's disease, if they have neurodegeneration, and if they have neuroinflammation. And so so Cassava Sciences, in a phase 2 open label, they were the first company ever. SIMUFILAM is the first drug ever to improve an entire panel of biomarkers: Alzheimer's disease, neurodegeneration, and neuroinflammation. And then in the phase 2B placebo controlled, they did it again. And now we're just seeing at 6 months from this open label. So at 9 months from this open label, cognition is really good. It takes a little time to get those biomarkers because it's the lumbar puncture, the spinal tap. But we now also, on Thursday, they released 6 months. So we already saw 6 month cognition data was really good, got even better at 9 months. But we now also have biomarkers from 6 months. And the biomarker data was sensational. So the biomarkers, for example, of how you diagnose someone with Alzheimer's disease, one of the ways to do that is there's one of these peptides called amyloid beta 42, and its ratio to total tau, which is another protein in the cerebral spinal fluid. That ratio in healthy people, and I think I flipped which one is which, but in healthy people, it's 0.44. And in this study, it brought Alzheimer's disease patients from 1.6 on average to 0.6 on average after 6 months. So you could say, oh, the cognition data, we can't rely on that because there's no placebo group. But how about these biomarkers? And so there's no placebo effect with biomarkers, and it's very strong in AD markers, in neurodegeneration, and in neuroinflammation, the entire panel. The lowest improvement, the worst improvement they had was 18% at 6 months, and there was improvements up to 84% in some of these biomarkers.
So, I mean, again, to kind of emphasize
Did I
the
bore you
point.
to death again? Are you there?
No, you should be. You could say, okay. There we go. Keep fading in and out here, so apologies on that. But so again, you're touching upon some stuff that really has never been done before. That kind of gives the hint here now. Well, given how quick, even when Biogen got approved and everything, how quick they were, granted breakthrough designation and whatnot. How does that relate here now with Cassava? Do you, in your opinion, given even everything that you're talking about regarding the biomarkers, you're talking about improvements in cognition, not just retention in cognition, which Remy, the Cassava CEO, he had mentioned a couple of times actually before the conference that it would be remarkable to retain cognition at 9 months, let alone improve, correct? So now you're talking about an improvement in cognition at 9 months, and you're talking about Biogen that got approved with breakthrough designation very soon after they were approved, correct? So in your opinion now, what's the next step here regarding Cassava and how that relates to the FDA and breakthrough designation for them?
So when Biogen's aducanumab got approved just recently, one of the things that the FDA said in its statement is they were looking at biomarkers. So there's the plaques in the brain. So there's the amyloid beta plaques. Removing them, the theory is maybe it will improve cognition. And that's what the FDA said, is that they showed that they removed the plaques. And the theory is that biomarker could then extrapolate into cognitive benefit. And because it's there's no good benefit, no good medicines out there, we thought we would let people have the option, and so they approved it on the biomarker data, not efficacy data, biomarker data that was suggestive of efficacy. And so, along with its lousy safety, it's like, I mean, Cassava already, is way better as far as efficacy. You don't have to, you could go to the extremely strong biomarker data if you wanted to, but just look at the extremely strong and consistent efficacy data in the first place. And then Lilly, just about a month ago, got breakthrough therapy designation. So this sort of opened the floodgates. Biogen's aducanumab is a monoclonal antibody. And then a lot of these companies going after amyloid beta plaques, a lot of these companies have them. And so now they're all as Remy said, they're dusting them off and bringing them out. So Eli Lilly has another one, and it's the same thing. They showed that it'll remove plaque. And again, and so the FDA just said, if you can remove plaque, we'll pretend that is a benefit, and we'll even overlook all the safety and everything else. So just on they could, but for breakthrough therapy designation, it's got to be a serious or there's two requirements. It's got to be a serious or life-threatening disease, and it has to have preliminary clinical evidence of a benefit over what is available. Well, there's nothing good available, and there is preliminary, and it's got to be, doesn't have to be, it's preliminary. So preliminary, Cassava has tons of evidence saying, look, this looks way better than what's out there. And you can say, well, it hasn't been through really long phase 3 trials. Well, preliminary, we got that in spades. So if it seems to have satisfied criteria for breakthrough therapy designation long ago. It's a very serious, life-threatening disease, and there's preliminary evidence that it's better than what's out there. And so so what the approval of aducanumab and the breakthrough therapy designation for donanemab, how do you say that one, both bode very well. If there's consistency at all with the FDA, that bodes very well for breakthrough therapy designation. It's overdue now, if you ask me. And they've satisfied both of those requirements. So it's time, and it's certainly, if they're going to be consistent, we could hear any day if the FDA is going to be consistent with what they did with Lilly and Biogen.
You would have to think that too, right? Like, can you hear me, right?
Now I can, yeah.
Okay, there we go. So I mean, in order to remain consistent, especially when you're looking at something that was as controversial as Biogen and even the reaction, not only from the public, but even inside the FDA, you have to think that given what happened and given the fact that they're kind of walking a little bit of a tightrope, would you see that as more of an opportunity now for them to recover here by approving SIMUFILAM and kind of taking that turn and being like, okay, look, let's not even talk about where we may or may not have screwed up, depending on what side of the fence you're on. But let's talk about what we can do now going forward. The point is that we do have this candidate here that actually does show really what I'm thinking, and I'm even just going through this in my head, is I feel like Biogen may have just gotten to the punch first, and Cassava, they were. They were kind of in blackout, obviously leading up to AAIC, where, having gotten invited there, they were one of the only companies that did get invited, correct?
Right. And a lot of the other companies paid to be there. They were sponsors. I didn't really hear anything come out of that conference other than SIMUFILAM's great data and SAVADX as well. Because other than Cassava Sciences, I don't think anything else was too exciting that came out of that whole conference.
And I mean, I would have to agree. I mean, it was not only spectacular news that we did hear about, but even thinking about like how, again, I'm going to go back to the FDA and approving or going through any sort of BTD with Cassava. You got to think they're trying to kind of, they may or may not be trying to make up for it. Or if you're on the other side of the fence, maybe they're scared now, right? Like you have to think about both sides, right? Like I don't want to just say yes to everything that's coming through, especially when it deals with the same space. So I would have to think, obviously, for us and anyone who is kind of long in a position with Sava, that you have to think that it should come sooner than later. Especially as it relates to kind of the with everything that's going on with Biogen, correct?
That's a really good point. This is a chance, perhaps, for the FDA to change the narrative, and people could quickly forget about the Biogen controversy if they said, you know what, here's a new candidate. We're giving a breakthrough therapy designation. And if either now or soon, we're going to give them accelerated approval, which comes with breakthrough therapy designation. And if they're going to give people the chance to make a choice to choose aducanumab or not, given that it might or might not help, and it comes with health risks. Yeah, so it's a chance for them to redeem themselves in the public's eye, change the story, have people forget about what happened with Biogen. On the other hand, like you say, fair enough. Maybe it makes them they got slapped on the wrist for approving this, so maybe they've got to be more careful about approving going forward. Well, there's nothing to be careful of here. The safety and efficacy, the safety and toleration. It's been safe and well tolerated in every study for more than a decade. So that's not even a risk. And then the efficacy is extremely good, just efficacy, not even having to extrapolate from biomarkers. But if you did want to extrapolate from biomarkers, like you're doing with Lilly and Biogen, we shine there. So it seems like I understand what you're saying, that it could be that they're more hesitant now. But another thing about that is, if we look at COVID, this is the same group of people at risk. So the people that are dying from COVID are the same people, the elderly population that is at risk for Alzheimer's disease. How are they acting with respect to the treatments coming out for them for COVID? They're rushing them to market. And as now there's things coming out like maybe they don't last very long, maybe they're not good for the variants. There's people having a lot of stories about just getting sick right after the treatment, and maybe that's they were the lucky ones, because there's other stories about people having some pretty bad complications. Well, there's been no signal at all, no safety signal at all with SIMUFILAM, and Alzheimer's disease is always fatal. So it's a good point that maybe they'll be more hesitant, but just look at COVID, and they're not being hesitant there. It's the same group of people, and like someone said, Alzheimer's disease is COVID in slow motion, in that it's always fatal, and it's killing elderly people.
Yeah, and I mean it's been a huge issue for so many for so long. I didn't even disclose this earlier, but I personally don't even have a family member or a close friend or anyone who does suffer from Alzheimer's, but I have seen others who do. And just that kind of impact where there really is an emotional bond, not only to trying to find a treatment for this, but it really has just been it's like this ambiguous, crazy, difficult, disease to find a cure for. And I feel like Sava really is on the brink of something spectacular here, and it just hasn't been given the credit that it really should be given, on top of falsified claims and false information that has been spread. Before we dive into all that, it's funny you mentioned COVID, because I do have someone in the chat here who said, would this be similar to the FDA waiver for the COVID vaccine? Like that, which you were just talking about. So go ahead.
Well, it seems just like it. If they're going to be consistent, then here's another. If they're going to be consistent with biomarkers, that's great for Cassava. If they're going to be consistent with just efficacy, that's great. Or they're going to be consistent with risks around safety and toleration. Well, it's extremely good around safety, well toleration. And then so getting these waivers. I mean, why not give, if it's a disease that's always fatal, why not give people the option? So yes, if they're going to be consistent, there's another a great point, is that if they're going to be consistent, it sure looks like they'll be very lenient with SIMUFILAM.
All right. Well, you heard it here first, guys. So let's change a little bit. We're going to aim, now that we have some background, some substance to what what you and I believe and what we've seen going on, and truly how remarkable this really is. Let's dive in a little bit to the other side here. What the heck is going on with the share price? I mean, what is going on with these claims that are circulating? There's all kinds of short seller information that people want to know and hear about. And you know, how does any of this have anything to do with what was actually reported at AAIC, that could be that there's any sort of correlation here, or do you think this might just be some kind of insane opportunity to buy the dip, as you will?
Well, the share price was up 30x over the last 12 months and like 15x year to date. And so it was up quite a bit. And there were short, or so on Thursday and Friday, it basically went from like 140 to 70. So the now at the beginning of the year was like 7, so it's still up quite a bit. But it got basically cut in half right when they released these amazing historic results. And these articles all came out like right at the time that as if they acted like they had analyzed the results and taken everything in and here's what we think, but it was already all done and they released it right away and they had people's quotes and everything. So it was and they still didn't sway sentiment, in my opinion, because there's just so little you can say about SIMUFILAM, about the results. There's so little you can criticize them for. And so they put an article out. They had people say, you know, mean things, nasty things, whatever. But all they could really say was like general stuff, like that it's inappropriate at this time to make assumptions. Or like they couldn't say anything bad. They just had to say general stuff. And so they said, well, it's an open label. You know, there's no placebo. Okay, but they had a placebo, and they've got these extremely strong biomarkers, and they had it in preclinical murine models. There's no placebo effect in any of that stuff. And it's been consistent all the way. But the thing is, when those results came out, so this is the real deal. And the market cap before it got cut in half was around 5 billion. Well, Biogen's around 50 billion. And Biogen is only going to get to maybe 180,000 total people. SIMUFILAM can get to millions. And there's no need really so take something like Biogen's aducanumab or Lilly's donanemab, or however you say it. There's no need for them now. There's no need for them really ever. But once you have a real treatment, what doctor that is in their right mind would put people on one of those therapies instead of SIMUFILAM? So there is a lot. And then even at the AAIC conference, there was a lot of people either seemingly connected to Biogen and Lilly and more concerned with that connection than with the actual exciting science that came out. And so but I still don't think that they changed sentiment. So I don't think there was an indirect destruction of the share price. It was direct. They shorted 11 million shares over. So the average share volume in general is like 3 or 4 or something like that million shares in total. They shorted 11 million shares over 2 days when like 45 total million shares traded. Well, there's only 40 million total shares. So this was not, on these great results, this was not moms and pops selling their shares. Oh no, this is not what I thought it was. This was people probably had margin. People were probably very confident in the results. And so instead of sentiment changing and saying, oh no, these aren't good results, they just got $5 billion together and said, let's use this cash to crush this stock, cut it in half, we'll short it high and scoop it up low, and then we'll, with our, like Alliance Bernstein, they've got their long at 65. Well, then so institutions can, now that it's de-risked and these great results came out, we'll spend $5 billion. All these people that are margin we'll force them to sell. People will also have stop losses. We'll clean those out. And by spending $5 billion to cut this in half, we'll be able to make some money shorting high and covering low, but also scoop up all these shares that are now de-risked. So that seems like that's what happened. And Adam Feuerstein, who's got a history of doing this, and he's got a reputation, that's fine. But he got involved, and his thing is it's not even that people believe him, but once he publishes something, it's like, the fix is in, and whether people believe it or not, they're going to spend a lot of money to move this price where they need it to be because they see an opportunity. And so it's a market, and everybody's in it to make money. It seems particularly grating when it's something like this where they're trying to help people. And if this company was selling cigarettes and they were going after it, that would be one thing. But they're trying to save the world, they're such a nice company, but they attacked. And but still, the company is up like 10x for the year. And on these results, this is a buying opportunity. So they did people a favor. This is now de-risked like crazy. This drug could be the best-selling drug of all time easily, and it's at half price after it's de-risked. It won't last, in my opinion. So if you're just hearing about this, in my opinion, they did you a favor. And either way, on these results, this is going to go much, much higher. And I think in the article I did 2 articles ago, I gave it a share price. They could be $150 billion market cap. So if they get to 2 million people, or if they get to 1.5 million people, there's more than 6 million Americans with AD. So they get to just a quarter of those, 20K each, not 56K like aducanumab, but 20K each.
And you're talking about the treatment, correct? The actual cost for the treatment, correct? Okay.
Yeah, for SIMUFILAM, yep. That gets them to $150 billion market cap, and that seems pretty conservative. That's not even anything internationally. That's no SAVADX. That's no treating other conditions. So anyway, that puts them about 100x where they are now, about 50x. Let's see, they're 70.
If you're saying 150 and that right now we're showing a 3 billion market cap, yeah, you're on 50x.
50x. So if it is in fact the blockbuster AD treatment, this sell off on these results, you don't just get a sell off. You get the drug is incredibly de-risked now with that biomarker data and that strong efficacy, along with the consistency in all studies. It just seems so de-risked and so much cheaper now. So they did us. So the hedge funds and shorts and big pharma, they did us a favor if you go long now.
Well, there's a couple things I also want to touch on just in regards to what's going on with the share. I mean, you're looking at over 25 million shares in volume just on Friday alone. And I mean, this thing on an average day, you're talking around maybe somewhere between 2 and 3 million. So where do you kind of get that kind of volume? I mean, it's pretty obvious, right? I mean, you don't just get it out of thin air, and there's only one way to get it down to that low. And you're absolutely right when you hit the marker saying, there are people that have stop loss and they know where those levels are. I mean, it's very obvious. So when you see that and you can easily, I think they may have put their foot in their mouth though, because obviously Sava has been trending as a result of this, and they've also been shown to lose 60% in 48 hours with good news. I mean, there's greater forces at work here. Obviously, if you could think about who could actually be behind this type of volume, this type of decline, and this significance of do I dare say manipulation in this case to get it to this level, right?
Direct manipulation, total manipulation, of course. Yeah.
And go ahead.
I wouldn't count on the SEC doing anything, but absolutely. But I still have no problem saying yes, definitely manipulation. Yeah. Because
I really feel like it gets to a point where I think it's like FOMO in a way. And I feel like a lot of these guys missed out at a lower price when they saw that it was getting better. And now they're like, why should we pay 1/4? Let's use our money to get it down and screw the little guys and all the retail traders that are out there that actually do have some faith in this thing, and the people that are actually emotionally attached to it as well. And let's tank it, ruin it. And then all of a sudden, now, how are you going to get any sort of money from or an offer from this? Big Pharma, one of the most political kind of industries in the game, is going to swoop in here and say, well, if your share price is only worth 70, why am I going to pay for 3,000 a share? Get out of here, to take a hike. But subliminally, I mean, I think we could all kind of look at some of the messages that are being here. It didn't help that we that Cassava, really, not we. Cassava, they by announcing 9-month data and telling at AAIC that they were going to announce this data, that was kind of like a beacon for shorts, really, as opposed to just dropping it on everyone, pre-market or something like this and watching everyone scramble. I mean, yeah.
You're exactly right, and I hope I'm sure they learned that lesson in February when they released 6 months data that we got where we were we were a lot higher than we were now after 9 month data, and because you're right, people there was an ambush, and it can't last forever. It's a buying opportunity, but I think you're exactly right that it's just got to be shock and awe and not letting the market know what's coming.
Not to mention, I mean, we were talking even the other day, on the Discord. Why? By the way, if anyone does want to tune into any of the socials for Sava, there is a Discord for it. If you just type in !Sava in the chat, I posted all the links for anyone who is interested. So that's just for anyone who does want to know. But even before the conference, right? The day before the conference, we're talking Wednesday afternoon, correct? So Wednesday afternoon, just as the market was about to close, and we have a viewer in chat who even said wasn't there a boatload of options that were purchased at $75 right before the close of the market, on Wednesday, right before the conference happens, right before anything. And I know that Remy and the rest of the team, they had announced, I mean, they dropped some clues along the way. And so I think everyone's got their confidence up. You had a ton of people buying it up, but this allowed the shorts to kind of coordinate this sort of manipulation and ultimately tank the price to where you're seeing right now. I think it's really more just a matter of time before you do start getting boatloads of money from institutions who are ready to hop in before any sort of other good news comes out. Yeah.
Yeah, I mean, we'll see if it's over or not, but my guess, we'll see. But my guess is they tried to get in and out on Thursday and Friday because they did their job, 140 to 70. They did it, and there was a lot of volume, especially starting around noon, finishing up through Friday. So maybe they're done, knowing that institutions would have the weekend to get caught up. Because this is a great, amazing story, a great, amazing drug. Probably has a great chance to be bigger than Lipitor. So I think that they're done. Maybe they're not, but either way, if they're not great, let them drive it down and scoop it up low. This is, if it's going to 37.50, maybe conservatively, hey, once in a lifetime, maybe.
Yeah, right. I mean, and that's. I'm thinking that over the weekend, people have had a chance to actually digest this information. Maybe it was a little bit of a shell shock on Thursday, and everyone was like, well, everyone's saying it's bad, but they're saying it's good. I don't know what to believe. Friday carries over, right?
They keep it going for 30 hours from Thursday morning till Friday close.
Yeah.
So they could keep, if with Furstein's article and with FUD and confusion, they only had to keep people from figuring it out for 30 hours. That was it.
Yeah, and I mean, not to mention, on top of what you were just disclosing as the reasons why this could become something even bigger than it is even now, there's a huge amount of insider ownership. I mean, we should talk about that only because that kind of shows how confident management is. And at 6 months, when this actually did spike up to over 120, right? I believe that was February, correct? Management didn't sell. They didn't even sell a piece of it then, right? I mean, what kind of indications does that give?
They've bought since then. Yeah. I mean, Remy has more. Remy, the CEO, has more than 100, or at least he did have more than $100 million in options. He didn't sell any. It was up to 140. That was the most it would ever been a few days ago, Tuesday or Wednesday. He sold zero. And I mean, he could. That's more. That's more than $100 million. If he was in it for the money, he could just say, "See you later." So, and then Sanford Robertson is on the board of Salesforce.com. He and Remy both own about 2.5 or 3%, and they both bought after, I guess, 6 months. And they both bought recently after they got their options. They went even longer. They sold enough options to pay their taxes, and then went even longer, even though it can't possibly change their lifestyle. They have so much. So they haven't sold any. They've only they only keep going longer, and if this turns into Biogen, or not Biogen, if this turns into Gilead, Vertex, and which it seems like it is, they'll Remy could be like an Elon Musk type. I don't, maybe not that much, but it'll be.
Yeah, I hear you.
Now, yeah.
Okay. So, I mean, last question here, and this will kind of wrap everything up. Given where everything is right now, what is pretty evident in the market, I mean, what everything that's been happening, and kind of making a tumultuous situation out of everything. How soon, in your opinion, do you think there could be a turnaround, and would you expect any sort of kind of insider or management response to what's going on? Because essentially, like we said, if insiders do have this kind of ownership in the company, and essentially it's just been hacked by 60%, I mean, me personally, I'd probably be a little upset. And so I can only imagine that the same kind of thought process going on in the eyes of management. What is your opinion on this on the outlook here?
I think, like the rest of us, they were surprised by the ambush. I think that they thought they were going to release amazing, miraculous, historic data, and the market would react in kind. And it turns out somebody was waiting, and I think they were surprised as everybody else. And I do think there'll be a response coming relatively quickly. I was not at the AAIC, but I'm told, at least people in the comments of the article say that there was also a portion of her speech that cut out. I don't know if that was Biogen. I don't know if it was Biogen that was giving us tech issues here today.
Yeah, probably.
But there was they said supposedly that there may be testimonials. Well, if you recall last year, their 2B was great. The placebo-controlled 2B was great. But first, there's somebody analyzed their data and said that, for example, that placebo patients were all over the map. And so the analysis was completely bogus and was completely debunked. And then when they did that, they had to debunk it. So what they did was they brought a doctor running one of the trials on. She said, I have no conflict of interest. Here's what I'm seeing. Patients are getting better. And so it worked. It worked really well. So okay, this is it debunked the nonsense bogus analysis. And so somebody that was there at the conference said that there's some testimonials or something. So they did that before when they had to debunk when they were under attack, I guess you might say a different way, but they responded that way. I do think that they'll respond with that. There's also other catalysts. We have the 12-month data we waited extra long for the 9-month data because of AAIC, but they had it maybe as far back as the end of April, but certainly probably May. So they'll have 12-month data September, October. So that's coming up. They've got, in my opinion, breakthrough therapy designation. If they applied in end of June, so they will wait to be guided by the FDA to apply for breakthrough therapy designation. They recently changed on June 21st. They did a press release changing the design of their phase 3s, like they were always going to. They were always going to have another meeting with the FDA and then finalize the phase 3s. Well, they issued a press release June 21, and the phase 3s had changed, indicating maybe they had their meeting. So maybe they had their meeting mid-June and they got guided to apply for BDT, which would put 60 days for FDA to so maybe they applied end of June BDT, and then FDA has 60 days to respond. So we could have BTD coming. But so there's BTD, there's 12-month results. There's going to be full enrollment there's going to be 100 patients at at the 6th month point. There's going to be full enrollment of CMS. There's a whole bunch of there's SAVADX. There's a whole bunch of catalysts coming automatically. But yes, I do think that like they responded after the bogus analysis, I think the company will respond, and I think that they were blindsided, frankly. Look, we all were. And that I think that they will respond.
Well, just one thing I do want to point out, even as you were mentioning catalysts here, they have earnings coming up. I mean, they have earnings coming up. I believe it's August 11th, so we're looking 10 days from now. They're going to give right? I think it's the 11th. Pretty sure. So
it was right around last year that they had. I think it was an earnings call that they brought the doctor on to that call. So that's a great point.
Correct. And in that earnings call, they probably could talk about how they have all this cash on their balance sheet right now, and they can make it through phase 3 by themselves easily.
Easily.
So
they possibly They possibly could have made it through phase 3 with the cash they had on hand before, and then after the 6 month results, the stock soared so much they raised another 200 million, because why not? But they probably maybe had enough before, and then they quintupled what they had. So they have way more money to fund all of their operations than they need for years.
Awesome. All right. Well, unless there's anything else that you wanted to touch on before we wrap up here, I mean, I do have. I'm going to put your latest published article out behind me here on the stream. If anyone wants to check out Joe Springer on Seeking Alpha, he is very bullish, as the article indicates. If you want to read more about it, you certainly can. I can post links and everything in the description and in Discord if anyone does want to tune in more from Joe and see the rest of the community who is kind of driving behind Cassava and hopefully seeing a turnaround in what has been presented and the news that should come out of these guys at some point in the future. But before I sign off here, Joe, is there anything else that you wanted to add? Any other kind of commentary you wanted to provide for anyone who does view this?
Matt, I want to say thank you to you. It's been, this whole community around Cassava has been one of the funnest things about this. And it's just been really fun meeting everybody and working with everybody. I really appreciate you, Matt. Thanks a lot for help shining a spotlight on this. And I've been a lot of fun talking to you. I appreciate it.
Oh, of course, no problem. Well, thank you so much for tuning in. I'll catch up with you after we sign off here on the stream. I want to thank everyone for tuning in today on the stream, whether you're new here, whether you've been here for as long as I've been streaming, which is quite a long time. But either case, thank you guys so much. Good luck to everyone who's involved, and I really do hope that we get some strong results going on here with Sava, and that the support continues to grow. So, thank you guys again, and we'll catch you on the next one.
Cool. Thank you.